Hi, my name is Lisa Summer and I'm in Speech 151 at SWIC with Julie Willis. Today I would like to talk to you about the human heart and specifically three aspects of the human heart. The heart is an amazing pump. The heart has electrical activity, so it gets excited. And the heart also has social emotional aspects that affect our mental health. I would like to use my visual aids for assistance here. The heart is an amazing pump. There are four chambers to the heart. There are the upper atria, and then there are lower ventricles. There are four valves present. There's valves that separate the atria from the ventricles, and then there are valves that separate the heart from the lungs. From WebMD, this information was obtained about how blood goes through the heart. It enters through the two large veins, the superior and inferior vena cava. This blood is deoxygenated. It goes in this way. It goes to the lungs. It comes back from the lungs, and then it goes into the left ventricle, and that is pushed out through the rest of the body. Your left ventricular ejection fraction is something that doctors use often to determine how well your heart is functioning. According to the American Heart Association, EF, left ventricular ejection fraction, is good if it is 50 to 70%. If it is less than 45%, you may need a pacemaker. If it is more than 75%, you'll need medical management. The illness I'd like to highlight in this section is cardiomyopathy, that is enlargement of the heart. It can lead to heart failure or congestive heart failure. Some signs and symptoms can be breathlessness with exertion or at rest, swelling in the ankles and feet, fatigue, bloating. You want to watch your blood pressure, try to get regular checkups, and eat a low salt diet. Cardiomyopathy causes the pericardium here to get thick, and then it just doesn't pump as well. And from the Science Museum of Minnesota, I learned that the heart pumps between 6,000 and 7,500 liters of blood per day. So our hearts are working really hard for us. Moving on to the second aspect I would like to go over is the heart's electrical activity. Let's do the wave. The heart gets very excited with electrical activity. This is monitored with an electrocardiogram. That's a test that doctors can perform on the heart's electrical activity. You put leads on the patient with a specialized gel that conducts the electrical activity of the heart, and you get your wave strip. Again, I'll refer to my visual aids here for us. Make sure it's right side up. So let's do the wave. This information was obtained from the Mayo Clinic about the P wave is atrial depolarization. We call this when the heart fires. It always fires from the SA node unless you have some kind of heart defects, and then the heart can fire from a different node. The heart firing shoots off from the SA node, and it travels to the Bachmann's bundle, down the bundle of His, to the Purkinje fibers and the rest of the heart. There's atrial depolarization, repolarization, and then ventricular depolarization and repolarization. That is one wave form. In the medical field, we pull a 6-second strip, so we look at your waveform for 6 seconds and decide if it is normal sinus. If it's normal sinus, then you're considered a normal rate and rhythm. There's many different aspects that could be wrong with the heart in this section as well. The one that I chose to highlight is atrial fibrillation from the Mayo Clinic. The heart begin to quiver, so they kind of dance like this instead of beat in a regular beat. They quiver. Atrial fibrillation is an irregular rhythm. It is a conduction system abnormality or situation, and I drew a little picture here for you. It's when there is misfiring in the atria. Eventually, the heart picks up a regular firing pattern, usually in the bundle of His, and then shoots down. it's electrical firing to the ventricles, and then the ventricles then pump blood to the rest of the body, and it starts over again in a pattern. This can affect how well your heart pumps, which we learned about in the first unit that I talked about. Signs and symptoms can include palpitations, shortness of breath, fatigue. Those are all very common to atrial fibrillation. Patients with atrial fibrillation must be on blood thinners. You may have heard of Coumadin. There are some newer ones out on the market today as well. There's optional treatments that include cardioversions, where they actually stop the heart from beating in hoping to pick it back up again in normal sinus. There's ablations, where they go in with little instruments and they try to burn off the areas where the heart is misfiring. And then there are other options as well to help prevent stroke. The risk of stroke is very high with atrial fibrillation, so you want to get regular checkups, and with both of these situations you want to try to eat a low salt diet. Moving on to the last topic I would like to discuss is the heart's social, emotional, psychological aspects that it has for us. I mean, most everybody knows when the heart is happy, when the heart is in good health, we usually feel decent. We are usually not depressed. Issues with the heart can lead to psychological issues such as depression or anxiety. And some heart issues are real. I would like to mention broken heart syndrome. According to the Mayo Clinic, it can be a temporary condition brought on by extreme stress and extreme emotions. It can become severe, and often it is called, broken heart syndrome is called stress-induced cardiomyopathy, of which I discussed cardiomyopathy in Unit 1, or Section 1. It is also called Takotsubo cardiomyopathy, which it was named after a special octopus. I thought that was a very interesting little tidbit of information. It mostly affects women, although broken heart syndrome can affect both sexes. Some say Debbie Reynolds died from broken heart syndrome from the loss of her daughter. Symptoms can be mental health issues such as depression. It can also be physical signs and symptoms such as shortness of breath, chest pain, a weakened left ventricle. The heart is actually smaller on tests. You can actually see broken heart syndrome. The heart actually changes in physical appearance when someone suffers from broken heart syndrome for an extended period of time. And it will tie into an eventual failure to thrive if it is not resolved. The second information I wanted to highlight here today was the movie Inside Out by Disney and Pixar. The heart has lots of emotions tied to it as well. In the movie, anger, sadness, disgust, fear, and joy were all given a role. And it was a coming-age story about loss and love. And you may notice that love was left out of the movie Inside Out because it believed that love is not a true emotion. This information was obtained from Psychology Today about love, lust, attachment, and leading into the final topic I would like to mention is heartache, that wretched feeling. One of my favorite songs is Tina Turner's What's Love Got to Do with It. Love and heartache have a tendency to go hand in hand. The heartstrings, you may not know, are real pieces of tissue inside the heart. They are attached to the valves, which I mentioned earlier in the previous section. The chordae tendineae is the medical term for the heartstrings. And during heartache, it doesn't have to be extreme heartache, but the chordae tendineae tend to get thinner. They can get weaker, which can, again, affect how well the heart pumps with its pumping action. For heartache and heartbreak, all we can do is do our best to emotionally and socially cope well, which can be difficult in times. Heartache and extreme heartache and heartbreak can lead back to broken heart syndrome if it's not appropriately treated. In conclusion, I hope you enjoyed my presentation on the human heart. The heart is amazing in its pumping action, and it gives us the opportunity to express our feelings and our emotions. It also pumps blood to all of our body, which contributes to circulation, how well our organs receive their nutrients. It gets excited with electrical activity and keeps us functioning properly on a day-to-day basis. So please keep your hearts healthy and follow up with regular checkups and keep your heart beating.